Does Sculptra cause scar tissue? Should I be concerned about getting Sculptra because it forms a bad type of collagen? What if I want to have a facelift in the future? We're about to embark on unlocking a Pandora's box of questions with few clear-cut answers.
Sculptra is a very one-of-a-kind, unique product that works differently from fillers because it stimulates collagen. And I'm a big fan of Sculptra, as some of you may know. And I'm not currently sponsored or affiliated with any pharmaceutical company, so I have no disclosures to declare. I am here to tell you the clear-cut truth. As some of you may know, there are a number of practitioners who believe that Sculptra forms bad collagen or scar tissue.
You can take bad collagen and use it to your advantage when you're looking at the calculated risk. You're saying, I know I'm going to form granulation tissue, so I'm doing it deep, and I'm trying to build up scar tissue to gain bulk because I have no other way to gain bulk. There's some logic in that and can be defended. To say, let me put Sculptra all under the dermis to try to form more collagen in the dermis, you're kind of pushing it there.
Just to clarify, when we reference scar tissue, we're referring to what lie underneath the skin. We're not talking about something that you can see on the surface of the skin or a visible scar tissue. Also in this video, we're not talking about nodules or granulomas. That's a different video, which you can check out after you watch this one. We are going to take a deep dive into the science of skin, and I've got the answers to your questions, so stay tuned.
What type of collagen does Sculptra form? Does Sculptra form bad collagen? In our body, there are at least 28 different types of collagens. In the second layer of skin, known as our dermis, type 1 collagen accounts for approximately 80%, and type 3 collagen accounts for approximately 10 to 15%. Together, both types 1 and 3 collagen give our skin its tensile strength.
So when the question is posed, does Sculptra form scar tissue? What you'll commonly hear referenced by the company is that
Sculptra forms mainly type 1 collagen and an insignificant amount of type 3, and granulation tissue or scar tissue is made up of mainly type 3 collagen.
this is true. But here's the crucial piece of the missing puzzle. Type 3 collagen gets laid down early in the forming of granulation tissue or scar tissue.
So let's say we were to injure our skin, we get cut. Early in the wound healing process, fibroblasts, the cells that make collagen, initially lay down the weaker form of collagen, which is type 3 collagen, in order to form granulation tissue. But later in the wound healing process, it's replaced by type 1 collagen. Furthermore, most scars, including hypertrophic scars and keloids, scars that you can visibly see on the surface of the skin, they're mainly made of collagen type 1 and a little bit of type 3.
So that still leaves the question unanswered because the collagen type doesn't really get to the root of answering the question, does Sculptra form scar tissue? Because Sculptra was shown to form the same collagen types that's in normal skin and the same collagen types that's in scar tissue. So
what constitutes scar tissue? In humans, collagen fibers found in normal tissue are arranged in a random basket weave formation, but in scars, the collagen forms crosslinks to align in a single direction parallel to the skin.
So does Sculptra cause this type of pattern that you see in scar tissue where the collagen fibers are aligned more parallel instead of a random basket weave-like pattern? I have no idea. We don't know yet because as to date, no known studies have been done to evaluate this. The only studies to date have indicated the collagen type that's formed from Sculptra, which I just mentioned. But
according to the company that manufactures Sculptra, they're doing ongoing research of gene expression and so far have found that there have been no genes upregulated with scar tissue. So then, why do some practitioners believe that Sculptra forms scar tissue?
well, what we do know from various studies of how
Sculptra, short for PLLA or polyallactic acid, how it works to produce collagen is that as the PLLA is degraded, the connective tissue's response around the implant results in a gradual filling with new collagen fibers at the site that it formerly occupied. This fibroplasia produces the desired cosmetic result. Another study states Sculptra stimulates the synthesis and deposition of fibrous tissue and collagen. Yet another study, thus forming mature vascularized fibrous tissue.
So fibrous tissue is more like scar tissue.
How else are we going to grow new collagen if we don't have fibroplasia? In fibroplasia and granulation tissue formation, fibroblasts grow and form a new provisional extracellular matrix by excreting collagen.
And when we say Sculptra stimulates collagen, it's the truth. it stimulates collagen. And fibrous tissue is also made of collagen. So these are both true statements. But what we really have to ask ourselves
is this fibrous tissue bad? Let's explore the previous study in more detail. Therefore, neocollagenesis, which is the formation of new collagen and the consequent increase of dermal tissue, establishes the desired cosmetic result. Let's go back to this study, which cites this fibroplasia produces the desired cosmetic result with increased dermis thickness.
why would you want to create fibrous tissue? Why would that be desired?
Should you really be worried about forming fibrous tissue from Sculptra?
I don't think you should worry, and here's why. When you think about what happens to our skin as we age, fibroplasia, or tissue that's more fibrotic, isn't necessarily a bad thing. And the reason why is because we know how the collagen in our skin deteriorates with age.
Collagen and its relation to aging skin. An optimal production of collagen is essential for healthy, youthful-looking skin. As we age, the enzymes responsible for the degradation of collagen gradually increase in the skin over time, and overall, the amount of collagen per unit area in the skin decreases by approximately 1% every year. In the dermis, type 1 collagen fibers undergo structural changes that reduce their tension force, leading to higher levels of degradation and lower rates of replacement, which leads to an increase in the amount of type 3 collagen over time. So type 1 collagen, the stronger collagen, is turning to type 3, the weaker collagen. This causes the skin to become thinner and less elastic, and this weakening and low production of collagen fibers is the reason that we get wrinkles and sagging skin.
Let me ask you a question. If Sculptra helped improve the quality of your skin and it gave it a tightening effect, it made it firmer, would that be a bad thing or a good thing? Comment in the comment section and let me know. Sculptra has been FDA approved for cosmetic use since 2009, and it just recently got FDA approved for a new indication of the face, and it's now been clinically shown to firm or tighten the skin and improve the skin quality. This is something I've known and seen for years from treating myself and on the patients I've treated with Sculptra. The skin becomes more firm and it gives you a glow. So if some people want to call this bad collagen, I say bring on the bad collagen. I'm not bothered at all if my internal skin tissue is a bit more fibrous, because my skin and the skin of patients treated with Sculptra, it doesn't look like scar tissue and it doesn't feel like scar tissue to the touch. And in this instance, I don't think that the fibroplasia, or what some refer to as scar tissue, is a bad thing.
For some odd reason, everybody thinks scar tissue is negative. Oftentimes in filling and thread lifting and using PLLA Sculptra, we're using this inflammatory response to get the result we want. So you want this scar tissue to work for you, to lift, to add volume, to make the skin texture better. So I don't think the scar tissue is bad as we know. So it's a negative effect that people think about, but it's not. Actually, this scar tissue is positive.
As we discussed, our skin ages and it's already undergoing structural changes. Not only does Sculptra not cause visible scar tissue, but it improves skin quality, and some people even use it to treat acne scars. I've been using Sculptra for several years, so I personally don't care if under a microscope my collagen fibers run more parallel as opposed to running in a more basket weave direction. And I expect the skin to be thicker because Sculptra thickens skin, which we've known for years. So if Sculptra is forming collagen tissue that's slightly more fibrotic than my natural collagen that's being depleted from aging anyways by about 1% a year, the collagen that's turning from type 1, the stronger collagen, to type 3, the weaker collagen, I'm not bothered by it at all, because I know if I didn't do Sculptra, my face would look more hollow, it would look more gaunt, and I would have more loss of elasticity, which eventually would lead to sagging. Sculptra for me was life-changing. So as of now, you have a few options. Age naturally, which obviously you wouldn't want to do if you're interested in this topic, or do a biostimulator like Sculptra, which stimulates your skin to make collagen. And you can also use fillers, and fillers are great, but as explained in this video, I think there's a certain point where you don't want to solely rely on filler to add volume to every single area of your face. Or you can get a facelift with fat transfer, and guess what happens when you get a facelift? You form scar tissue. Surgery causes the most, or the worst kind of scar tissue, because you're dissecting through both layers of skin and deeper tissue, and not only is it more scar tissue, it's visible scar tissue.
Can you get a facelift after Sculptra?
The type of facelift that we do nowadays is called deep plane facelift, which it sounds kind of weird, but basically what it means is like we're going underneath the muscle and lifting, so we're kind of below the scar tissue, therefore making the lifting not so difficult.
So if the surgeons who are out there are concerned with the scar tissue from Sculptra, well, what happens when you do surgery? Not just a facelift, a nose job, a lip lift. Any surgery will cause visible and internal scar tissue, especially if you do more than one surgery.
I remember when I was doing my rotations through OBGYN, if a woman already had a C-section or multiple C-sections in the past, the surgeon struggled a little bit more and it was more difficult to cut through the skin because of the scar tissue, but her C-section could still be done.
And if you do end up getting surgery, you're injuring the skin and your skin has to heal itself. And it does so by forming new skin tissue, which will be internal and visible scar tissue. Is that a good, healthy type of collagen or is that a bad collagen? I'm sure anyone getting surgery will just be happy that their skin healed. The comment section is an open platform, and if anyone, including practitioners, has anything to add, please feel free to comment in the comment section. Let me know if you have any more questions. I hope this answered your questions that you shouldn't be concerned with Sculptra and scar tissue. And if you want to learn more about the magic of Sculptra, be sure to check these videos out.